Bringing a new life into the world is a miraculous experience, and every birth story is unique. While many mothers-to-be hope for a vaginal delivery, sometimes a cesarean birth, also known as a C-section, becomes necessary or is the preferred choice. A cesarean birth is a surgical procedure where the baby is delivered through an incision made in the mother's abdomen and uterus. It's a safe and effective way to deliver a baby, especially when complications arise during labor or pregnancy. Cesarean births have become increasingly common over the years, and understanding the reasons behind this trend is important. In some cases, medical reasons necessitate a C-section to ensure the safety of both mother and baby. Other times, expectant mothers may opt for a planned cesarean due to personal preferences or specific circumstances. Whatever the reason, it's crucial for expectant parents to have access to accurate information about both vaginal and cesarean births. This knowledge empowers them to make informed decisions about their birth plan in consultation with their healthcare providers. This essay aims to provide a comprehensive overview of cesarean births, exploring both the advantages and disadvantages associated with this delivery method. By understanding the benefits and risks involved, expectant mothers can approach their birth experience with greater confidence and make choices that align with their individual needs and values. There are various reasons why a cesarean birth might be chosen or become necessary. Sometimes a C-section is planned in advance due to pre-existing medical conditions or pregnancy complications. Other times, the decision for a cesarean arises during labor, often in response to unforeseen circumstances. One common reason for a planned cesarean is when the baby is in a breech position, meaning the baby's feet or buttocks are positioned to be delivered first. This can make vaginal delivery difficult and risky. Similarly, if the baby is in a transverse position, lying horizontally across the uterus, a C-section is typically recommended. Certain medical conditions in the mother, such as placenta previa, where the placenta covers the cervix, or preeclampsia, high blood pressure during pregnancy, may also necessitate a planned cesarean. Multiple pregnancies, such as twins or triplets, often lead to C-sections due to the increased complexity of delivering multiple babies vaginally. During labor, unexpected complications can occur that may require an emergency cesarean. For example, if labor fails to progress or the baby shows signs of distress, a C-section allows for a swift delivery to ensure the well-being of both mother and baby. Ultimately, the decision to proceed with a cesarean birth is made on a case-by-case basis, considering the specific circumstances and the health of those involved. Cesarean births offer several advantages, making them a safe and viable option for many mothers and babies. One significant advantage is that C-sections allow for planned deliveries. This can be particularly beneficial for women with certain medical conditions, allowing their healthcare providers to closely monitor their health and schedule the delivery at the optimal time for both mother and baby. For babies in distress or facing complications during labor, a C-section can be a life-saving intervention. The ability to swiftly deliver the baby through surgery ensures the baby receives immediate medical attention, minimizing potential risks. Cesarean births also reduce the risk of certain birth injuries that can occur during vaginal deliveries, such as oxygen deprivation or physical trauma. Another advantage is that C-sections can sometimes preserve the mother's pelvic floor muscles, which play a crucial role in bladder control and sexual function. Vaginal deliveries can sometimes weaken these muscles, leading to issues later in life. By opting for a C-section, some mothers may reduce their risk of experiencing these problems. Section 4. Disadvantages of cesarean birth. While cesarean births offer numerous advantages, it's essential to acknowledge the potential disadvantages associated with this surgical procedure. As with any surgery, C-sections carry inherent risks, including infection, bleeding, and adverse reactions to anesthesia. The recovery period for a C-section is generally longer than that of a vaginal delivery, requiring more time for the incision to heal and for the mother to regain her strength. Women who have C-sections may experience more pain and discomfort after delivery, often requiring pain medication and limiting their mobility. This can make it challenging to care for a newborn and manage daily tasks during the initial weeks of motherhood. Additionally, C-sections can increase the risk of complications in future pregnancies. For instance, women who've had a C-section may face a higher chance of developing placenta accreta, a condition where the placenta attaches too deeply into the uterine wall. This can lead to significant blood loss during delivery and may even require a hysterectomy. Furthermore, some studies suggest that babies born via C-section may have a slightly increased risk of developing certain health issues, such as asthma or allergies later in life. This knowledge empowers them to make informed decisions about their birth plan in consultation with their healthcare providers. This essay aims to provide a comprehensive overview of cesarean births, exploring both the advantages and disadvantages associated with this delivery method. By understanding the benefits and risks involved, expectant mothers can approach their birth experience with greater confidence and make choices that align with their individual needs and values.